Hey, it's Dr. Jeff with Dynamic Spine Chiropractic. In this video, we're going to discuss the number one question that we get in the office. What is a good pillow for me to use to prevent neck and back pain, right? Really to dive into this, what we're going to talk about is number one, what is normal positioning of the spine when you sleep? Number two, what pillows must we absolutely avoid and never use? And then most importantly is what is a pillow that actually supports optimal spine alignment so we don't have neck pain, we don't have headaches after we sleep. What is a normal spine? When we're looking at a spine from front to back, we want to see nice straight structure. So this is the 7 bones of the neck. When we look at it from a side view, however, we want to see that there's a slight curve to the spine. That's called the cervical lordosis. And what that curve basically does is it allows for a lessening of the muscle tension on the neck, an abnormal distribution of weight on the discs, and then it keeps the head upright over the shoulders so our posture is well maintained. So this is the structure we want while we sleep, and we want a pillow that supports these structures. So there are 5 major things to avoid when you're picking on a certain pillow to use. 5 major findings. Number one pillow and number one mistake that we see is the pillow is actually too thick if you're a side sleeper. Now this picture is a great depiction. This is a normal sized pillow. You can see how it's holding the neck nice and straight from the side. But if the pillow is too thick, as you can see here, it can actually create a bend or a curve in the spine. Now the problem with sleeping in these postures, it's not a bad thing if you do it for 10 minutes or 20 minutes, but just imagine if you were watching a movie or sitting at home and you held your head tilted like this for about 8 hours, or anywhere between 6 to 8 hours. Even if you move from time to time, if you're holding your head with a tilt, it puts a lot of strain on the muscles on the opposite side and the discs on the concave side, and over time you can wake up with a very stiff neck pain. A lot of times we also have people that get headaches. So we want to make sure that we maintain this normal straight spine alignment while we sleep. Again, if it's too thick, it'll actually create a curvature of the spine. Next is if you're a side sleeper and the pillow is too thin. So this picture is a great depiction. Again, this is a normal straight neck while we sleep. That's what we want. If the pillow were to be too thick, it angles the head upward. But likewise, if the pillow is too thin and you're a side sleeper, it will actually drop the angle of the neck down. So again, you can err on one side or the other. The typical way I tell people to get straight when they're sleeping is to make sure you have a pillow that measures between your ear and your shoulder. That way when you lie on your side, your head doesn't tilt down or up. It just supports the distance between these two. So top of the shoulder to the ear, okay? Now the third mistake, this one's very, very common. If you're a back sleeper, the pillow's too thick. Remember, from the side, the curve or the neck should have a slight curve. It's called the cervical lordosis. Typically, you want that between 20 to 40 degrees. If the pillow is too thick, when we lie on our back, it will actually buckle the neck forward, as you can see in this picture here. So what we want to do is we want to lower the height of the pillow, which would allow the neck curve to buckle back to its normal lordosis. So a pillow that is too thick pushes the head forward. Usually when people are sleeping in those positions or using those pillows, they wake up with a lot of neck stiffness and discomfort. And it also actually acts to close down the airways of the throat. And so sometimes people can struggle with snoring more as well, which is an interesting fact. So make sure, get your pillow height low so your cervical lordosis can maintain itself while you sleep. Next is the arch in the pillow does not fit your neck specifically. So we've all seen the Tempur-Pedic pillows where they have multiple rolls and angles to them. Those are good. The problem is they're not really custom designed or made to fit for your specific neck. The example is they give you typically 2 different sizes. The problem is if this is too wide, it will actually push your neck forward into an abnormal curve. And if it's too small, it won't hold enough of an arc into the actual neck itself. So you want to make sure that whatever pillow you use, that arch fits well in the crease of your neck and make sure it holds the normal positioning. They're also tough to use in terms of side sleeping because they're not so much designed to sleep on the side. And then the final one, my favorite one, is stomach sleeping. We're going to keep this simple. Avoid it at all costs. The biggest problem with stomach sleeping is when you're lying on your stomach, your head can't sit centered because you'd be face into the mattress. So you have your head turned one way or the other. The problem with that is when your head is turned so far, usually it's about 60 degrees minimum, it puts a lot of strain on the opposite side musculature. And we see people that have chronic headaches and migraines that are stomach sleepers primarily, and that's a big problem. So you want to avoid stomach sleeping. Going back to that initial analogy is if you're watching a movie for 6 to 8 hours and you're sitting in a chair and your head is turned to watch that movie the entire time, at the end of the movie you're going to have a little bit of neck pain, if not a lot. So definitely avoid sleeping on the stomach, and definitely avoid sleeping on your stomach on a log bench. That's about twice as bad. So the next question then comes, what is the best pillow for normal spine alignment and a healthy neck? The answer, this has recently come out. It's called the Denarol pillow. It's been patented by Denarol Industries and used by CBP, Chiropractic Biophysics. This pillow specifically is designed to help maintain a normal curve in the neck while you sleep on your back, and it has a pad that folds in so when you sleep on your side, you have no head tilt one way or the other. It keeps you straight and neutral. So this pillow in particular was designed for optimal spinal health. It was engineered with specificity and made so that you can sleep in a position, and basically what you're doing is you're supporting the normal alignment while you're on your back or your side. The only downside with these is you also do have to get them ordered through a doctor. The reason is because they're just specific to your case. But the big benefit of this is it's basically turning sleep into a therapy for you. So instead of having 6 to 8 hours of sleep that's bothering your neck, again, you're turning that sleep session into a therapy so you can wake up and feel great. So I hope this video was helpful. I'm Dr. Jeff Watson with Dynamic Spine. As always, don't fight the pain, fix the problem. Take care.